Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, everybody. Welcome to this episode of the AMA Steps Forward podcast series. My name is Dr. Chen. I'm the Physician Director of Practice Sustainability here at the AMA. Before I joined the AMA, I was a clinical radiation oncologist who practiced in a variety of different settings, including a couple of small private practices in the community.
And I'm Taylor Johnson, the Manager of Physician Practice Development at the AMA. And prior to my time joining the AMA, I was a practice administrator for several different small practices.
Thanks for joining us, Taylor. Our topic of conversation today is engaging with a third-party billing company. In both private practices that I worked in, our billing was done in-house by our practice manager or a dedicated biller. But, as time progressed, the billing process became more and more complex and time-consuming, not only for our staff, but also for the physicians in the practice. I think with our practices and other practices such as ours, where those billing workload tasks and procedures were becoming overly burdensome, I think that opting for a third-party billing company is a very attractive option. I think also for physicians that are starting their own independent practices, this is also an attractive option. Taylor, being a former practice manager, what are the advantages of going with a third-party billing company?
Yeah, thanks, Dr. Chen. In thinking about the entire billing process between the practice, the payers, the third-party billing company can manage invoicing, collect payments, they can handle the claims processing and submission, or follow up on denied or unpaid claims. In addition, because they're strictly focused on billing, they can benefit practices by streamlining the billing process and in turn maximizing the practice's revenue and maintaining an up-to-date knowledge base of codes and regulatory changes. Also, because in many small practices, the staff involved in billing wear many hats, offloading the billing process can enhance overall practice efficiency by redirecting team members back to patient care. Even though third-party billing companies can offer these advantages, it's important to conduct due diligence and research the vendor options thoroughly. Also, it's important to remember that even if a vendor has great recommendations, it might not be the right fit for you or your practice. Now that we've talked about the upsides, Dr. Chen, what issues are you concerned about when offloading the billing process to a third party?
Thanks, Taylor. For me, I think it boils down to three possible downsides. The first one is cost, especially because there can be variable costs and hidden fees. The second, I think we're all in tune with, is data security concerns. But I think overarching, the number three downside that I can see is that you could lose control over the billing process and have little oversight. I think there's a couple of ways of minimizing these downside risks, beginning with a comprehensive contract that protects your interests and your practice's interests. This set of contracts will include a transparent service level agreement, which is an SLA or SLAs, and that establishes expectations and obligations between the two parties. I think a really robust discussion with yourself, your practice, and your vendor going over these documents can certainly help you understand all the costs and fee structures involved in those contracts. With respect to data security, I think it's really important to make sure that you and the vendor have a business associates agreement, a BAA, for handling protected health information, PHI. And this is, of course, in line with HIPAA, and that this business associates agreement will define the full scope of your expectations in that initial contract. Given that we have this set of documents, I think another thing that is really important in addition to this is that both parties should build in the plans for responding to a data breach, especially in this era where we have a lot of issues with data breaches. I think that's really important to spell out and to be explicit about it. So while I think third-party billing companies can offer some essential services, practice owners, practice leaders can really risk losing control over this entire billing process, being that it's very complex and have little oversight. So, the practice owners, obviously, this is your practice. You're going to care about your organization's finances more than anybody else. And so you as a practice owner should continue to monitor and manage third-party billing companies very carefully. Taylor, can you tell us some ways of how a practice or a physician owner can set up oversight of a third-party billing company?
Yeah. So I think developing clear policies and procedures from the very beginning with the vendor that you're working with is essential. So this could be just the day-to-day policies and procedures so that the practice has insight into each step that the billing company is going to take to make sure that the claims are clean and correct and they are successfully submitted to the clearinghouse. And then from there, what is the billing company or the vendor doing to make sure that the clearinghouse received those files and claims correctly and then successfully transferred those files to the correct payers? And are they making sure that the payers received the files? Do they have all of the dates and the required confirmation numbers for each claim and each payer? All of that is really important. And then on the other side, when the claims are processed and those processed results come back through to the practice, making sure that all of the claims and with the correct claim status are given back to the practice and then they're followed up on. And so they can do this by scheduling regular meetings with the vendor to review the accounts receivable. In these meetings, the billing company will walk through everything that I had just said, and this really keeps the billing company on track, and it allows the practices to monitor their performance and indicate whether the revenue cycle is running optimally. Also, in these policies and procedures, there should be an in case of emergency procedure, such as how to address issues or disputes that can't be resolved through normal avenues. And a good idea to even include a contingency plan in case the billing company suddenly goes out of business and the practice has to then, on very short notice, take on that load of the billing and claim submission and everything like that. We've actually created a downloadable resource that's linked in the episode description that includes an example meeting agenda that you could use as a starting point. And I highly recommend that you check this out for a breakdown of what should be reviewed in the regular meetings and then just different things that the practice should be on top of when it comes to their vendor. And then in addition to all this, it's important that members of the practice team stay engaged in the claim submission and reimbursement process to avoid aging claims errors and inconsistencies.
Taylor, I think you've really identified some important ways of making sure that billing companies really doing the job that they're supposed to be doing. And it's definitely important to continue to monitor and manage these third-party billing companies, especially to keep some of these risks at a minimum. I think we need to also highlight that we shouldn't forget to maintain thorough records of related documentations and correspondences between the practice and the billing company. The resource that you mentioned also includes helpful guidance for conducting routine audits, which I think are another tool to make sure that we're monitoring, or you are monitoring in your practice, the billing companies, what they're doing. And so whether that's performed in-house or by a third party, these are obviously ways to make sure that everything's on track. So obviously, this is a lot to think about, potentially going with a third-party billing company or starting out your own private practice with a third-party billing company. But I think the resource that we have provides a lot of helpful information in figuring out what's best for you, your practice, your patients, and a roadmap for getting started. Again, that's linked in today's episode description. And for more information on how to transform your private practice, we also have a wealth of resources at stepsforward.org. So thanks for listening.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.